Hello, and a massive welcome to you all. Are you ready to get smart about your health in just a few minutes? Today, we are diving deep into a topic that affects millions of people every single year all around the globe. We are talking about pneumonia. It sounds a bit scary, doesn't it? But don't you worry one bit. Here at Happy Health 10, our goal is to break it all down for you. We will make it super simple and super clear. By the time we are finished, you will have all the essential information you need, delivered fast and straight to the point. Let's get started on our health mission together. This guide is your 5-minute masterclass. Think of it as a quick and powerful download of knowledge directly into your brain. We are going to tackle pneumonia from every angle. What is it? What causes it? How can you tell if you or someone you love might have it? And, most importantly, what can you do about it? Knowledge is power, especially when it comes to looking after your body. Understanding pneumonia is the very first step to protecting yourself and your family. So buckle up and get ready to become a pneumonia expert in no time at all. This is all about empowering you with the facts. Our mission is to cut through all the confusing medical jargon you might find elsewhere. We are not here to use big, complicated words that leave you scratching your head. Instead, we are going to use simple, everyday language that everyone can understand. Imagine we are just having a friendly chat about health. We will talk about germs, we will talk about your lungs. We will talk about how your amazing body works to fight off infections. It is going to be informative, energetic, and maybe even a little bit fun. Your health journey should be an exciting one, not a confusing one. And we are here to guide you every step of the way. So, let's make a promise to each other right now. Let's promise to pay close attention for the next few minutes. By the end of this, you will feel much more confident about this common illness. You will know what to look out for and what steps to take. This is not just about learning. It's about taking control of your health and well-being. Your body is your most precious possession, and learning how to care for it is the best investment you can ever make. Are you ready? Fantastic. Let's jump right in and begin our journey to mastering pneumonia together. Let's do this. Okay, let's get right to it. What is pneumonia? In the simplest terms, pneumonia is an infection in one or both of your lungs. Imagine your lungs are like two big, spongy balloons inside your chest. When you breathe, they fill up with air. Your body uses the oxygen from that air to stay healthy and full of energy. But sometimes, tiny troublemaking germs can get inside these balloons. When that happens, they can cause a lot of mischief. They cause an infection that makes the tiny air sacs in your lungs, called alveoli, fill up with fluid or pus. This makes it much harder for you to breathe. So, where do these pesky germs come from? Well, there are 3 main culprits we need to talk about. The first and most common one is bacteria. Think of bacteria as tiny invaders that can multiply quickly once they get inside your lungs. The second big cause is viruses. Yes, the very same kinds of viruses that can give you a common cold or the flu can also lead to pneumonia. They can weaken your lungs, making it easier for a secondary bacterial infection to take hold. It is a bit like one bad guy opening the door for another one to sneak in and cause even more trouble. The third cause, which is a bit less common but still important to know, is fungi. These are tiny organisms, like molds or yeasts, that can be found in the environment, such as in soil or bird droppings. For most people with a strong immune system, breathing these in is not a problem at all. Your body just fights them off without you even noticing. However, for people whose bodies have a harder time fighting infections, these fungi can settle in the lungs and start to grow, leading to what we call fungal pneumonia. It is a good reminder of how amazing our immune system truly is. Now, you might be wondering how these germs actually get into your lungs in the first place. It is usually through breathing them in. When someone who is sick with one of these germs coughs or sneezes, they send tiny droplets flying into the air. If you are nearby and you breathe in those droplets, the germs can travel down into your lungs. You can also get it by touching a surface, like a doorknob or a handrail, that has germs on it and then touching your mouth or nose. It's a sneaky journey, but these germs are determined to find a new home. So, how can you tell if you or someone else might have pneumonia? What are the clues your body gives you? The symptoms can sometimes be a bit tricky. They can look a lot like a very bad cold or the flu. But there are some key signs to watch out for. One of the biggest and most noticeable symptoms is a cough. not just a little tickle in your throat. Often a deep, chesty cough that just won't go away. Sometimes you might cough up yucky phlegm, greenish yellow or a bit bloody. Another major sign, having trouble breathing. Air sacs, alveoli, can fill with fluid, so getting a full breath feels much harder. You might feel breathless even while sitting still. You might be breathing faster than usual. Short, shallow breaths. Some people feel a sharp, stabbing chest pain. It gets worse with deep breaths or when coughing. It's a sign something's wrong in your chest. With infection, your body fights back, and that causes other symptoms. A high temperature, a fever is common. Hot and sweaty 1 minute, then chills and shivering the next. Feeling extremely tired and weak is another big clue. Not just a bit run down, deep, full-body exhaustion that makes getting out of bed a huge effort. Your body is using energy to fight the infection. Other signs can pop up. You might lose your appetite. Older adults can become confused or mentally changed. This can be very serious. Babies and very young children can show different signs. They may not cough, but they may be vomiting, have no energy, or have difficulty feeding. Pay close attention to these signs. If you see them, get checked by a doctor. Don't wait. Now, let's talk about who needs to be extra careful. While anyone can get pneumonia, some people are definitely more likely to get it than others. Their bodies might have a tougher time fighting off those invading germs. At the top of this list are the very young, babies and young children under the age of 2, and the very old, older adults, especially those over the age of 65. People with long-term health problems are also at higher risk. Asthma, COPD, cystic fibrosis. Other chronic illnesses increase risk: heart disease, diabetes, kidney disease. A weakened immune system raises risk: HIV, AIDS, chemotherapy, and other cancer treatments. Another major risk factor is smoking. Smoking damages your lungs. It harms the tiny hair-like cilia that sweep out mucus and germs. When cilia are damaged, it's like the lung cleaning crew went on strike. Germs can stick around and multiply, increasing infection risk. Quitting smoking lets your lungs heal and defend themselves. So what happens when your doctor thinks you have pneumonia? First, they listen to your chest with a stethoscope. They often hear crackling or bubbling, signs of fluid in the lungs. Next, they'll usually order a chest X-ray. A chest X-ray shows where the infection is and how much lung is affected. They may also take a blood test, or collect a sample of your phlegm to identify the germ. Once the doctor knows you have pneumonia, the treatment can begin. The type of treatment depends on which germ is causing the infection. If it's bacteria, your doctor will prescribe antibiotics. Prevention is your secret superpower. Vaccination is one of our most effective tools. Pneumococcal vaccine is recommended for young children, older adults. Don't forget your annual flu jab. Good hygiene helps a lot. Wash hands often with soap and water after coughing. No soap? Use alcohol-based hand sanitizer. Try not to touch your eyes. If you smoke, make a plan to quit. Eat a balanced diet. Get regular exercise. Get enough sleep to keep your immune system strong. Quick-fire summary. What is it? An infection in your lungs that fills them with fluid. Causes: bacteria, viruses, sometimes fungi. Symptoms: bad cough, fever, trouble breathing, chest pain. Risk factors: the very young, older adults, smokers, and people with other health problems. Treatment: rest, fluids, medicines like antibiotics for bacterial pneumonia. Prevention: get vaccinated, wash your hands, and don't smoke.